My name is CWilsonOttey, and today I will be talking about national security and healthcare. My slides are 1 to 24, therefore, I will not read word for word, but I will point out the important information that I have researched on both national security and healthcare. In the United States of America, opportunities are always on the rise. Our current government policies have allowed citizens to live freely under the public and private economic market that has a host of jobs for even the smallest task. However, with every available opportunity, there comes an open fault in its system. For years, the United States government has dealt with a series of issues that fractured the American people, from upsurge in the national debt, immigration, threats of terrorism, and COVID-19. Difficulties that faced the country existed in different forms, seen and unseen. Therefore, the government must act to improve every area that has been impacted. Several areas that have affected the country are the lack of benefits for the mentally ill, immigration, and deficiency in the funding for national security. Lack of mental health benefits. The government has struggled to create an efficient solution to an healthcare problem. So every year it appeared that new laws are passed to resolve the crisis we encounter, but instead it put a rise to its many expenses. Insurance companies that provide healthcare have become limited to the masses and have become very expensive to those who attempt to afford it, thus creating a fractured system. The American health system is overrun with a crucial mental health epidemic, and the lack of a structured healthcare policy handicaps the mentally ill to the point of disillusionment. Due to the lack of steady policies, there is an overutilization of resources needed for mental health aid. Most problems with mental health care can be tailored to inadequate resources. The lack of assessment of resources poses an impediment to the development of mental health policies in general. While this major barrier affects people with mental health on a global scale, the lack of a solid understanding that outside factors, including political actions, can create a serious disadvantage for the mentally ill throughout the nation. How is Medicare involved? One solution made to tackle the mental health crisis is a complete restructure of the country's Medicare system. Currently, the problem with Medicare has to deal with its growth in spending. Healthcare spending affects several factors, which include the delivery of care, the use of services, hospital insurance, which is Medicare Part A, medical insurance, which is Medicare Part B, and 30% prescription drugs. Here is a graph that is showing actual and projected average annual growth rate in Medicare and private health insurance spending. Since the year 2017, the projected per capita spending was 4.6%, and for the projected year of 2027, we have a decrease of 4.3%. Medicare spending is affected by a number of factors, which includes beneficiaries, how care is delivered, the use of services, for example, prescription drugs, and healthcare price. Some of the solutions that we can take into consideration. Medicare for all. United States Senator Bernie Sanders has proposed a system that will repair the issue discovered in Medicare. This solution, titled Medicare for All, it is a proposition to cover all health insurance costs for the people of the nation. The bill urges the federal government to have a financial solution to healthcare policy issue, opening a way for those with mental illness to have an affordable prescription. Their solution. Medicare for All is a single payer healthcare system designed to point where a single public policy covers the cost of essential healthcare for all residents. Medicare for All is a vital matter in the 2020 election, and that's because those challenges have been exacerbated by the coronavirus, which has not only upended the way medical healthcare is delivered, but has also created conditions that would worsen existing mental health issues or lead to new ones. Medicare for All is said to include a comprehensive healthcare coverage that is free at the point of service. Saunders says Medicare solution would include expansion and improvement of multiple areas, including patient service, mental health, and substance abuse treatment. Helping the community. Former Mayor of South Bend, Pete Buttigieg, does not see the same ideas as Bernie Sanders. Instead, Buttigieg would rather tackle the situation of mental illness by working with the community. Buttigieg's act aimed to tackle the problem head-on, starting with the youth of America. Buttigieg's proposal, Healing and Belonging in America, a plan to improve mental health care and combat addiction, highlights the long-standing problems of depression and anxiety in the youth of America, especially for those dealing with struggles that they cannot control. For instance, a young adult, Kathleen Donahue, started therapy in high school. She was depressed and had self-harm and had misused prescription drugs. Miss Donahue, now 23, stopped getting mental health care when she moved away from college. The plan is an aim to have the government open its door and provide more extensive resources to combat mental health and addiction problems. With these, Buttigieg hoped to have approximately 75% of people receiving mental health care, more facilities necessary for aiding the mentally ill rather than giving them a choice only through affordability. What age does mental health start? Mental age statistics by age. Depression, anxiety, behavior disorder, all these are a part of mental health. Statistics have shown that depression and anxiety have increased over time. Ever having been diagnosed with each anxiety or depression among children aged 6 to 17 years has increased from 5.4% in 2003 to 8% in 2007 and 8.4% in 2011 to 2012. The rate of mental disorder, however, changes with age. The best decision. The solution that brings some repair to the healthcare system is for the government to have a better understanding of the issues of mental health. The government should have mental health treatment become more affordable. Create programs that encourage a sense of community and treatment towards those with an illness. A policy that follows in light of the document can be financially viable for the federal government through the use of single buyer policy. Medicare can be the starting insurance brand for patients that can afford it, while larger branches can expand on it as time progresses. If the younger generation does not get the right care, they are at risk, with a slew of problems occurring from their education and other factors, just as Kathleen Donahue. Another problem that is affecting America is overspending for national security. What are the issues? National security is of high importance to the United States government. Being one of the pillars that keep the country afloat, national security is often considered when discussing the state of the country and continuous risk of an impending terrorist attack. Issue stems from the current trouble that surrounds both national security and high risk of terrorism is stemming directly from within the federal government. We will protect our nation for our future generations. 9/11 has changed many laws and treaties as known today. The United States government has trouble creating a structure that would ensure efficient safety for the country and be as cost effective as possible. Homeland security spending. Following the event of September 11, 2001, the United States government, specifically Congress, has increased the amount of funding required to create a robust military system ready for any situation that may be deemed a threat to national security. The Department of Homeland Security was created to prevent terrorism, but actions pressured both the department and Congress had created an over-reliance on military. Here we have a graph that is plus and shows military and non-military discretionary spending in billions of 2015 dollars. Non-military Department of Homeland Security funding is expected to be an additional $43 billion in the fiscal year 2015. The amount of funding has increased since 2015. It highlights the problem of how the government has focused on nothing more than military funding without the awareness of how said over-reliance has damaged the economy. The first solution needed to reduce the cost of national security is for the government to assess and restructure some of its security-based policies. The strategic policies and doctrines created to combat terrorism are worthwhile ideas. Still, they have come across as flawed and somewhat outdated when compared to the form of terrorism used today, including cyberterrorism. The military has a robust system to combat any attack head-on, but it also creates a system that can be broken from the inside. One proposal from the article 11 Ways to Fix the United States National Security proposes the federal government to rewrite our strategies and targeting doctrines to address terrorism threats and attacks and establish guidelines for their attribution. This was said by Galligan. Galligan directly states that the executive branch should aim to recommend more regulatory revisions of the department. Solution. Second solution could assess both the issue of military funding and terrorism is for the government to modernize their programs in order to combat new national security threats. The strategy would require a more modern active military with resources that can combat cyber warfare and applied research that will keep our troops better equipped and trained. The local and state government should have more involvement as well. In their current form, both local and state government appear to nothing more than a responder to current events rather than to take action. Our best solution. Our best solution is ultimately Congress must restructure in national security policies and slow down its government funding. A restructuring would allow the government to assess any policies currently in action and streamline the amount of funding for departments unrelated to national security. Once Congress learns to focus their money on departments that are required, then both the private and public sector of the economy will flourish. So, the best solution is common sense and innovation. Government funding towards the military should not be altered or increased, but should have more of a focus on where the money needs to be funded and where money should be shortened. Congress and the Department of Defense should focus their money mainly on military departments that are necessary, but should also cut back in parts of the military that have little to no use. Conclusion. Conclusion. The United States is a diverse and convoluted culture. Government officials and bureaucrats render to promote ways to address the well-being of Americans. The tagline is to provide and expand the best possible healthcare strategy for the people under one regime, Medicaid for all. This way, there can be less abandonment of care and separation among the people due to the lack of federal funds and poor government engagement. These goals can be accomplished through ways that consider human entitlement, the right to health care, and mental illness awareness that leads to certain disclosures that alter areas in national security. My class, we have come to the end of this forum, and I have put together all the references that you will enjoy reading and researching. Thank you for listening.